I want to go over the parts of the dental implant, and it would be helpful if you would take your textbook, the Modern Dental Assisting textbook, and open it to page 819, because there are diagrams there about implants, and I'm hoping that my little description here will just help you out with understanding the dental implants. What you have here is you have the fixture. Now, this fixture needs to get placed into the alveolar bone, and the dentist will take and use different drill bits, and they will gradually make this opening larger and larger until they can fit the fixture in, and then it gets placed in slowly into the alveolar bone. Once that's done, on top you're going to put, or the dentist will put a little screw on top of the fixture. Now, depending on the procedure that they're using, it'll either be one of two screws. It'll either be a cover screw or a healing screw. These get placed on, and then the patient, there's a period of time, a few months, in order to allow the bone to actually fuse to the implant, and that's called osseointegration. Once that has taken place, then the screw is taken out. In some cases, they have to open the tissue and then unscrew this. Others, they don't cover the implant, they just leave it exposed. But the screw, whether it's a cover screw or healing screw, needs to be taken off. At that time, there will be attachments placed in here, and they will be taking a final impression, and this final impression will be sent off to the lab, and then on top goes your healing screw again. Once the dental lab has done their work, then the patient's brought back, and this will be taken off. There will be an abutment. So after the abutment is placed, there's a little screw that goes in, and it holds the abutment onto the fixture. And then what will need to happen is they will be placing either a cotton pellet or plumber's tape in order to fill in a little bit of the space between the screw that's holding the abutment onto the fixture. There's going to be a little space that they want to leave, and then they may take and put, say, a white filling material on here. If they ever have to take the abutment off, then all they do is remove a little bit of that composite material, remove either the plumber's tape or the cotton pellet, and then they can get to the screw so that they can remove the abutment. In order for the tooth to be secured onto the abutment, there's two ways. It can be cemented, so inside here, permanent cement can be placed, and then it will be cemented right onto the abutment. Or, in some cases, there's a hole in the tooth, and the dentist has a little screw that he screws it onto the abutment, and that's called screw retained. And then what they would do is they would just take and pack in a little cotton pellet or plumber's tape, and then they would put their composite material on top of that. Just a little bit more information about an implant, and it will help you to understand the information on page 819.